Hi, welcome to another episode of MYD Global. I'm your host, Leanne Hackman-Carty. In today's episode, I speak with Stephen Jordan, CEO of the Institute for Sustainable Development, about the coronavirus issue. A lot of us are talking about the health impact, but there's also the psychological and the socio-economic impacts. I'm speaking with Stephen about these in order to understand what this really means in the longer term. So stay tuned. Hey, Stephen, good to see you today. How are you doing?
Doing great.
Good.
Thank you so much.
Well, I really wanted to talk to you today about, given all this stuff happening with the coronavirus, we're hearing so much in the news about the health impact right now, but I know there's some other things we should be looking at, the socioeconomic side. And so maybe you can just talk a bit to that side of the equation.
Yeah. First of all, of course, the priority has to be saving people's lives and really taking care of the public health aspects. The challenge that we often have is that life continues to go on, and you have to think not just about the public health, but also about what happens next. Whether it's do you have your job still? Is the community still able to function? Are things able to keep on going? And so unfortunately, we don't have the luxury to just focus on public health. We have to focus on the social and economic impacts of this disaster as well.
So when you're looking at the social and economic impact, so kind of explain what you mean by those.
Well, for example, our children right now are really going through a very interesting period here of trying to figure out whether or not they're going to be able to stay in school, or if they're going to have to work or if they're going to have to study at home. And obviously, people go to class, they go to schools for a reason. So just that one act of social distancing, of having to cancel classes, is going to have some kind of a social or developmental impact on the children. And then because the children are maybe staying home, now increasingly you have parents having to make the tough decisions about whether or not they're going to have daycare or stay home as well. And so then you have a ripple effect into the workforce and into actually daycare capacity and those kind of issues. So the social dimensions, there's any number of ripple effects that you can take a look at here.
Well, and you look at nursing homes, seniors that are being told that you're high risk, that pretty soon they're not going to be allowed to go in and out. And that's really hard for them too. Family
Right.
can't come see them.
And so what people tend to say, okay, with something like the coronavirus or pandemic, they focus on the actual physical symptoms. Oh, got a cough, runny nose, fever, chills, shortness of breath, whatever the symptoms might be. But very, very rarely do people talk about the psychological effects.
Yeah.
And just because you can't see it doesn't mean that something isn't happening. And the real and another very serious problem with that is that people aren't necessarily going to tell you how they're feeling. They're not going to tell you about their emotions or their intentions. And so that can be very tricky. That's why in a lot of ways there's an invisible disaster that goes with the very tangible physical disaster that you see. And a lot of that is psychological.
Yeah. And I guess when you look at then the economic piece, when you see what's happening to the stock markets, when you see communities shutting their borders, countries shutting their borders, events being canceled. It's astronomical when you start to think, what is this ultimately the economic impact going to be?
Yeah, the ripple effects of this are going to be significant. You know, there are projections that it may shave as much as half a point in terms of world GDP this year, things like that. It's really too early to speculate how much or how little the longer term impacts can be. And the other thing that people should think about is that just because you don't have the event this month doesn't mean it can't be rescheduled. Basically, what you may be doing is just deferring purchases and consumption and jobs and projects. You may not be canceling them.
Yeah.
And I think that if you can have a mindset of deferring rather than canceling, that you're already a step forward in terms of hopefully returning back to normalcy a little bit sooner than you might otherwise.
So I guess this also gets to the point of preparedness and readiness for communities, for businesses. I would think in the communities I've spoken with, when they identified their top hazards, pandemics probably didn't rank really high.
Well, there's a reason for that. If you look back historically, dating back to the Spanish flu of 1919, there's been this cycle of either a gap of 10 years between pandemics or 30 years or 20 years. They don't, thank goodness, they really don't happen all the time and with a great deal of frequency. But when they do happen, they can be socially and community-wise absolutely devastating. They can turn cities into ghost towns, and people aren't used to knowing how to handle that. And so there's a real shock, a real panic that can set in. The one thing though that we should bear in mind is that even the worst of these plagues passes. They do pass, and life goes on. So I want to talk a little bit about the psychological aspect of all of this. When you look at it by the numbers, the public health authorities have actually done an amazing job in containing the spread of the coronavirus in comparison to past pandemics. The vectors of this have been broken or contained in ways that weren't done before. If you look at the swine flu, it escalated to over 500 million people very swiftly. And the numbers would in some cases double on a week by week basis. You'd go from 100,000 to 200,000 to 400,000 pretty darn fast. But what's happened with the coronavirus is that rather than the curve going like that, the curve has gone like this. It got from 40,000 to 70,000 cases in a week. And then since then, in about the last 4 weeks, there have only been an added 30,000 reported cases, which compared to other pandemics that we've seen is remarkable, especially given how globally connected everybody is. I don't think people are really processing the difference because there has been such a time lag between this epidemic and other epidemics. But when you compare them historically, we're getting better and better actually at the public health aspect. The reason this is striking so much fear is because it's unknown and it's uncertain. We deal in the United States, we live with 40,000 car accidents a year, fatalities. We deal with more than that, 50,000 to 60,000 opioid deaths a year. We have, depending on the flu season, tens of thousands of people died from the flu. And that pales when compared to how many people die of cancer and how many people die of heart disease. But these are known and managed risks. Mm-hmm. When you get on an airplane, the threat of a plane crash is always there. I mean, you're going into something that's going into the air very fast, right? But it's routinized. You know, almost everybody can recite who flies at all can recite the put your seat backs up, your tray tables in a locked position, make sure your seat belts are securely fastened. We know that routine and that thing. When you get into a car, you have the bumpers, you have the seat belts, you have the windshield wipers, you have these enormous safety features that we know. And we know how accidents may happen. With the flu, we have the flu shot. One of the things that we have to do psychologically is we have to get away from thinking of this as an unknown situation towards a situation that we are going to be able to manage. And once you do that, you're actually on the first step towards recovery.
I think that's in any disaster, right? The minute you realize you can do something and make a difference, then it gives you the ability to do that, to act. And
You're so right, Leanne. When you think about when you're sick, the worst time when you're sick is the part where you're just feeling terrible. The minute you start going to the doctor, the minute that you start taking medicine, the minute that you start taking control of what you're going to do, you're on the path to recovery. You psychologically feel better. So if I were to give advice to community leaders who are dealing with these issues, I would say, look, try and provide context and try and be sober and serious so that your stakeholders really know that you really care about what's going on, but also provide the context and don't allow rumors or negativity or pessimism to fester. And that's why having a strategic communications operation has to be a core part, actually, of your response to this crisis. And the other thing too is your demeanor. You have to model the behaviors that you want people to have.
Yeah, well, that's great advice. So is there anything else you want to share before we wrap up?
Yeah, I think that there are two different levels here that you want to look at. First of all, internally within your organization or your business or your government agency. The first thing, of course, is to be sure that your employees are taken care of and that you have protocols in place for what happens if they get sick, what happens if they get disrupted, what happens if they're in the position of having to be care providers. And also, I think something that you've raised that's very important is that you need to have a contingency plan for whether it's a low risk, moderate risk, or high risk. And I think that's an excellent point.
Yeah.
The other thing internally is very super critical is to manage your cash flow. Take a look at how you can defer payments, work with the holders of your fixed costs, see if there's possibilities for forbearance or loan negotiation, or really look at ways that you can manage your cash flow, especially if you think that your operations are going to be deferred rather than canceled. It's really important to try and hold on to people as much as possible. I know that some senior executives and some business leaders are taking pay cuts so that they can keep their employees going for as long as possible. And that kind of leadership by example goes a long way. Second, from an internal standpoint, beyond looking at finance, also very much look at communications. Make sure that you've set up a robust information gathering and information sharing mechanism for your organization. A lot of times there's rumors, innuendos, missing information. People like a scary story, right? And so what you want to do is you want to nip some of the negative things in the bud. You do want to share factual information as much as possible. And you do want to give people a kind of a sense of what is the destination? Where's the organization headed in the long term? And then the last part of this is really making sure that you are engaged with your customers and your vendors, and that you have a very good open channels of communication on both sides of the ledger there.
Yeah.
Then at the government level, local and state authorities, or provincial authorities, one of the challenges is, of course, divided government. No single government entity can pull all the levers that they would like to. So I would be sure, again, that you have a very strong and robust strategic communications plan, that you support the ability and the capacity of the small businesses and the businesses within your jurisdiction to defer decisions, not cancel them, as much as possible. And the other thing I would suggest is that you really focus in on the not just the public health, but the mental health aspects of all of this situation, the psychology of it. I would really strongly encourage municipalities to develop like a long-term planning group with the task of saying, what are we going to need to do to get back to normal? Not what are we just doing with public health, but what do we do in terms of helping to restore the social and economic fabric of our community, and actually have a dedicated group focused on that question.
Yeah, and I think, this kind of situation, which none of us could have foreseen, even a couple weeks ago, has really made it apparent that pre-planning, that having the discussions, the relationships in advance are so critical. Because when things like this happen and change on a daily basis, I mean, you need some kind of checkpoint that you can touch base on and go, okay, we're okay. We have plans in place. If this accelerates to this level, this is what we do. So, it'll be interesting to see how this all sorts out, because it will. But, giving people the tools and advice that they can be proactive and they can manage the situation, that's great advice. So yeah. Thank you.
Thank you so much.
And we'll do a link on the video to the Institute for Sustainable Development so people can find out more information. I know you're going to be providing some socio-economic research in the near future, so it'll be available there as well. So thanks for what you're doing, and stay safe.
Thank you, Leanne. Same to you.
Okay, bye-bye.
Bye.